Hello. Hi, everyone. Thank you for joining us. Hi, Stephen.
Hi, hi, Giles. Nice to see you. My name is Steve Ritchie. I'm joining you from Geneva, Switzerland, and Giles is joining us from the UK.
That's right.
And we're here to talk about digital transformation and human-centered parts of digital transformation. Before we get started, Giles, why don't you introduce yourself? Tell us a little bit about your journey into digital transformation and the human-centered part of your work.
Sure. So I work as a clinical UX strategist here at Whitespace. That means that most of my work really is on the research, design, and the business strategy, market strategy related to the healthcare technology. There's a particular focus on clinician and patient experience with this sort of work because I come from a clinical background. So I used to work as a junior doctor here in the United Kingdom, but it's been nearly 10 years now I've been working in clinical UX, and it's been a fun ride so far and great work here at Whitespace. And to your question about transformation, I think what unifies all UX professionals, anybody that's working in the design space, is about trying to make the lives of fellow human beings better. But my role working in healthcare and in clinical UX, as mentioned before, is really looking at how can I help clinicians? How can I help them have better workflows, better ways of doing their job, particularly when it involves digital technologies, and also how to help patients live healthier lives, particularly where they can be empowered to do more to manage their health. Not without any input from clinicians. I think we still definitely need clinician input, but it allows them to do more without feeling so dependent on the doctors to improve their health and other healthcare professionals. So that's my sort of work that I do within the transformation space. And a big part of that is behavior change, healthcare behavioral science, which ties in a lot with this general theme of human-centered digital transformation.
All right. I've been in basically the digital industry for years. I got involved
Mm.
in the late 90s when the internet was just getting started. I was in the East Coast in the United States. And I didn't get in from such a caring point of view as Giles. I didn't come in from being a doctor. I was studying literature. So I came in from concepts and words and narrative and storytelling right about the time that the old generation, the pre-digital generation, needed to understand what was going on with technology. So people like me were brought into the big agencies and the big clients to explain this new stuff to these clients that had never experienced it before. And this is when we had tiny little 480 by 640 screens. And I've evolved since then. I've worked across a lot of different industries. So finance, travel, sport, media, some medicine. And like Giles, I've gotten attracted more and more to not just the what we're building, but how people are using it. And that's been kind of my draw. The older I'm getting, I'm much more interested in what we're putting together for people and how they're actually engaging and it's changing them than the thing itself that we're building. Now, I hope all of you have scanned the code at the beginning. I'm going to give you there's a code to scan. So we can ask for your feedback in some of these sessions. And let me see how many of you are online now. There you go. There's the code to scan. We need you to scan that code or go to minty.com. Oh, actually, that's the wrong Minty code.
Is it the wrong one? That's
Yeah,
not
yeah,
good.
yeah.
The joys of modern technology. We've gone live, so anything can happen when you have a live show.
That's actually the old. That's the old deck.
Right. Let's sort that out. So, I think a key question we should be asking at this stage, though, before we move on, what is transformation? What do we mean by transformation? What do we mean by innovation?
Yeah, for us, I mean, we're not going to touch the innovation word. That's a whole
Mhm.
other topic we can get into. What we want to look at right now is transformation, and our definition, kind of a working definition, is bringing transformation or bringing technology into organizations to fundamentally change how we add value for our clients and for our stakeholders. That's it. That's a lot of gobbledygook big words. And this is part of what we want to do in this introductory series is break that down a little bit. And we obviously look at it from a different perspective than just technology. or from finance. Those are all very valid ways to look at it. But our take is going to be more from the human side. Giles, thanks. This is the correct Minty code. And what we'd like you to do is to scan that Minty code. And you're going to be asked in just a moment, you're going to be asked some questions. All right. Okay. Okay, can someone give us a thumbs up in the comments if they can see, if they are logged in and they can access this poll?
We have got folks joining us. Hi, Dan. Nice to see you there.
All right, there we go. Okay.
In Mumbai.
So what we want to do is for you to just fill out your key role. And I know this is sometimes hard to put yourself in a box, but just we would need to get an idea of kind of how to adapt our message to what y'all are doing. All right, so UX, CX. All right. Okay, we'll just give it a little bit more time for anybody to enter in. Oh, this sounds good. Driving digital success, that's your role. Good.
Yeah.
UX and service design. Looks like we might have a bit of preaching to the choir here today. We've got some fellow practitioners of customer experience, user experience. That's great. Excellent IT governance. Okay. That gives us a bit of an idea of your roles and what kind of the angle that you'll be listening from. We're going to go to the next quiz, little poll. Let us know which industry or sector that you work in the most. Now, if you're a consultant, which industry do you like working in the most? Like if you're like us, you work across many different industries. Which one do you like, or which one are you currently working in? Right.
So we're getting some answers coming through now. So quite a few so far as responses. About half are from health and life sciences. There's a few others. Quite curious to know what the others are.
For those of you who are other, why don't you just pop into the comments there and add which industry you work in or you prefer to work in the most.
And for those just joining us now, I'm going to add this in a comment. Or I would like to have. Yeah, let's get this shared with you as well. I'll find a way to get it to you. If you have got problems with scanning the QR code.
Right. Oh, you're right, Brian. We should have technology in the list. A lot of you working in technology are also working for technology in specific industries, but so we're interested in if you are doing technology for which industries or your preferred industries to apply technology. But yeah, I think a lot of you are working in technology. Okay. All right, guys, I think that's about stable. A good chunk of health and life sciences, given the sweet spot of what Whitespace does, that makes sense. And kind of across the board, some others. Giles, we'll go back to the presentation now. All right. So Giles, you had asked about digital transformation. Before we get started and keep going with this, we're obviously, Giles and I work for Whitespace. We are a strategic digital transformation consultancy. And we deal with all kinds of issues around digital transformation. And as I mentioned before, we look at change within organizations. And I'm going to pick apart a little bit the word transformation and digital. I'll be really honest with you. I'll have a confession. I don't really like it. The word transformation kind of put me off. And one reason is because I've been in technology since the mid 90s. And back in the 90s, we were building a new economy. We were revolutionizing industries. We were changing the world. And there was a lot of over promising and under delivering. A lot of it was putting shopping carts on very slow internet connections. And we didn't see the change that we were kind of hyping up. We got a lot of venture capital, a lot of money was pouring in, but that's one of the reasons why that word transformation kind of puts me off. And I've had to come to terms with that. So another thing is most of the people that we're working for, the end beneficiaries of the solutions that we're building, they don't walk into work wanting to be digitally transformed. They don't walk into the doctor's office thinking, I want to be digitally transformed, or the classroom, or the warehouse, or the construction site. They want to do the things they're already doing in a smoother way, in a more enjoyable way, in many ways, a more human way. And the technology in that case needs to become more and more invisible. One of the challenges we've seen a lot with our clients is people working on digital transformation projects build up a lot of energy and momentum within the organization around that term. Oh, we're working on these digital transformation things. And they're kind of confused when their colleagues in finance or in compliance or in distribution aren't particularly excited about that word digital transformation. So that's another reason not to raise that to wave the transformation flag. That being said, we can step back and find some inspiration in the word. As Giles said, when he first moved from being a practitioner of medicine into the digital world, it was that wanting to transform patients' interactions. And I think a lot of us on this call, I can tell by the work, the sectors you're in and the roles you're doing, do get some deep pleasure out of changing the way people are working. I think we've all met people who are happy to go about their jobs. They go in, they do their job. Maybe they take great pride in the craft of doing the thing that they've been doing for 30 years. And there's no great desire to change. For those of us that are drawn to change and drawn to helping change move humans in a positive way, we can redeem that word of transformation by finding some inspiration. And that's what I do. I hold both. I hold a bit of healthy cynicism about changing the world, and even about radically changing a company. But I also hold some inspiration at the same time. Another challenge we've seen with transformation is people thinking it means solely creating new businesses. And I've worked in some very old conservative companies in which some people got very excited. We're going to radically offer new business, entirely new businesses to our clients and new business offerings. When really what they were doing was modernizing their technology to be able to compete. And I would very much consider that transformation as well. Moving things to the cloud, getting things ready, or taking very traditional business roles, bringing new technology and changing the way we're still doing the same business. So I don't think it always has to be new business. We also want to challenge the word digital. I've worked with clients in very conservative IT departments in which the CTO, the chief technology officer, was very concerned with legacy telephone systems, with cabling, with networks, with hardware. And we would come in and pitch big digital projects, and they were shiny and they got budget. And it was hard building credibility with some of these more our CTOs that were concerned with running the day-to-day of hardware and infrastructure. So I think in terms of us being taken seriously among our colleagues, it helps to empathize and to see, it's not only about code running on screens. It's about all that infrastructure that makes that possible. It's also about the physical world. One of you had mentioned, hey, listen, do we even need to talk about technology in terms of transformation? Giles, a lot of the work you do in clinical UX, it's in very, very intensely dense physical environments. So tell us a little bit about that, about some of these clinical contexts in which digital is only one part of the whole service.
Yeah, so it's important, just like as my time as a doctor, and you kind of never stop being a doctor. People still come to you with their medical problems. Bit like as a UX, you can't switch off from dealing with seeing problems. But just like with dealing with patients, I have to recognize that yes, they come into me with their main problem, and this medication that I give them or recommendation for surgery is actually going to be very useful. There's a point before that that they see me. There's points after that. There's other issues that they have in their lives that are directly influenced by their health or influence their health, so their diet, or whether they can actually afford to buy food in the first place, but also the fact that there's other people that can be involved in that patient's healthcare as well. So similarly, when we look at digital health technologies or digital technology in general, we have to recognize that there's a workflow that this technology fits into. There's a goal being strived towards where using this digital technology is just a means to an end rather than an end in itself. There's other stuff that has to be done as well. I think a lot of designers are aware of this. It sometimes can be difficult for this to feed into the work we're doing and get buy-in from non-design folk, non-product folk who feel that, well, we just need to build this thing. Let's just build it because we've been told to build it. But we've got to recognize that the context is going to have huge influence, because even when you have got a great product that is easy to use, if it doesn't actually solve the problem better than a competitor, or if it's just too expensive, or actually it's a great idea, but the technology doesn't exist to make this commercial, then we're wasting our time here. So that process of recognizing what's really going on is really, really important, particularly in healthcare, where when we get it wrong, people can be harmed, if not sadly die.
Mhm. Giles, I want to ask you something else in this notion
Mhm.
of challenging transformation being purely digital.
Mhm.
It's beyond the code on screens.
Mhm.
Sometimes the place that code on screens, where it's placed, starts adding the real change. And I'm thinking about the work you're
Mhm.
doing with digital therapeutics, with
Yeah.
wearables. Essentially, it's the same information we've had on big screens before, and in some cases, it's new. Can you tell us a little bit about beyond digital to where the physical wearable thing is the thing that's really enabling the change?
Yeah, I think it's, for one, it's being able to increase the opportunities to gather the data that's coming from wearable technology as opposed to their more solid, non-movable counterparts. So even though we have blood pressure cuffs that you can have at home, which are completely automated, you don't have to get the stethoscope out and listening to the heartbeat as you're pumping up the cuff, which of old days, and still a good skill to have, I must admit. But that's not practical, and patients aren't going to do that for themselves. Actually, quite impractical to do it on your own. And having the regular digital electronic ones at home that can function on their own, they're also very good. But when you get this continuous monitoring, suddenly it's a game changer, because you're able to look for trends and patterns that you otherwise would never find. And this is particularly useful for clinicians. Like, as a clinician, a big part of my work is pattern recognition. I need to be asking questions, but also gathering data from other sources, examining the patient, looking at blood tests, but also observations, heart rate, blood pressure, temperature, respiratory rate, so on and so forth, and seeing the trend, because the result at just one moment of time can be very diagnostic. Like, if someone's got a heart rate of 120 beats per minute, I'm worried about them. But there's a
Yeah.
lot of people whose heart rate is actually 55 beats per minute, and I should feel very safe in the knowledge that they're okay, even though 55 beats per minute is below the normal range that we say of 60 to 100. But it's the trend, because if someone's dropped to 55 after normally be traveling with around 90 beats per minute, something's terribly wrong with this patient. Something's
And that,
going on.
and
So
that's
it's
something that that's
is
something that
important.
that's something that you as a doctor would not be able to know if they weren't wearing necessarily that device.
Yes,
And
that's
this is
right.
where the movement of the digital onto the wrist or onto
Mhm.
the thing on the body is what is starting to spark this transformation that's possible in so many fields. I guess the
Yes.
takeaway for those of you working in very different fields is start looking out of the corner of your eye beyond the screens, beyond the laptop, even before beyond the mobile. Start looking at how wearables, headsets can start changing things and ideating around that. So now that we've kind of accepted the word digital transformation, and for us, we use this at Whitespace quite a bit because it does seem to speak to the people we need to talk to actually enable real change. But as practitioners, we also are very bottom up and are skeptical. Giles, I'd like to move to the next slide here. Giles, can you get there? There we go. It's not such a secret anymore that digital transformation initiatives don't work. So we've just built this up. This is an inspirational term. This is something that we can live with. This is something we put in our taglines. The big consultancies, the big agencies, of course, want to argue that they don't work because then you need to hire them. You need to hire people like us to come and make them work. Once we get past that fact and we start looking at what does work really mean, what does success really look like, we can start to ask ourselves, why not, and what do they mean by failure? And specifically, McKinsey and BCG in the last 2 years, they did studies of people involved in digital transformation projects. They looked at financial goals. Did they hit their financial goals for the transformation? And in many cases, they found there were no concrete financial goals for the transformation, or they were abandoned soon after the initiative started. After all of these are the number of participants they interviewed. So McKinsey 1,024, Boston Consulting 895. I'd like to ask your guess of what percentage they found, and we've correlated this across other studies, and it correlates well across the work we've done with our clients. What percentage of digital transformations fail to achieve their objectives? Not necessarily financial, but any of the main objectives of this digital transformation project. What percentage of those fail? We're looking about some around, well, I'm guessing that looks about 80, 70. Someone just got a little bit more pessimistic. Yeah. Okay. Okay. All right. Someone a bit more optimistic. 50%. Yeah. Okay. All right. Well, we'll tell you what the average is across the studies. It's 70%. 70% of these very big, very strategic, usually very highly communicated initiatives are not achieving their objectives. And moving on to why. So we're trying to figure out, okay, this is very strange. And we could say this is because it's new technology. This is cutting edge machine learning and AI algorithms. It's normal they don't achieve their objectives because this is just so new. But in our experience, technology rarely makes the top 10 of why companies don't achieve their objectives with digital transformations. And much of the technology we're talking about here is 5 to 10 years old. We're talking about some cloud infrastructure that's been there for years that we're just trying to get legacy companies onto the cloud or using APIs and things like that. So we don't buy the fact that this is acceptable at 70%. Because it's inevitable because it's new technology. What we're looking at is more why from a human angle. Of course, some firms can look at it from a financial angle, but we're going to look at it from what are the people doing around these kinds of projects that are causing it to fail, and how can we, as human-centered designers and people coming from the field of human-centered design, increase those chances of success. All right, Giles, can we go back to the there we go. So what we've done is we've looked across all of our clients when they come to us and say things aren't working with our digital transformation. And we ask them why. What's gone on so far? What do you mean by failure? And then we compared that to what we've read across the industry and what we're talking about when we talk with other consultants and other practitioners, our peers. And we've condensed this down into 3 main reasons why digital transformations fail. The first is very much top down. So there's a lack of clear and consistent leadership, vision, strategy, and objectives. I particularly want to emphasize the clear and consistent, because most of these projects start with very dramatic, very clear leadership, inspiring visions, some strategy, big objectives, and then they get a dozen, 2 dozen, a few dozen, 100 people working on these projects. The CEO needs to go run the business and disappears, comes in once a quarter and gives a speech to the digital transformation initiative. This really rings true with our experience, and we've seen this across the literature as well. The second big reason for failure is services, and everything we're talking about here is we're offering people new services are misaligned with the context in which those people are living, working, and what they need. So there's just a disconnect. There's a disconnect of, even if those strategy and objectives were very clear at the top level, when it gets down to the level of people using keyboards and mice and webcams and wearables and going about their work, there is a disconnect. And then finally, the third reason, and this is very human, that the change and communication required for higher level transformation, the more you want to transform, the harder it's going to be. We're working against momentum. We're working against people that have been coming in and doing the same job every day for years. We're working with people that have been promoted and recognized for doing the things the same way and perfecting their craft or their job or their métier over years. Change is hard. And communication depends a lot on different audiences. And so one size doesn't fit all. So the good news, in terms of all this failure, is that practices that we have studied and have decades of experience in help with these problems. So we're going to talk about design thinking, discovery research, service design, and stakeholder alignment. These are part of what we at Whitespace are doing every day with our clients. And I think a lot of you, judging from your roles, are what you're doing as well. And for those of you who know a lot already about design thinking, discovery research, service design, what we're hoping is that maybe we can help you and find some ways to get it more recognized, to get it earlier in the process, to get it funded, to get the staff you need. What we're going to do is we're going to interview some of our colleagues. Giles and I are going to interview some of our colleagues who are actively working on digital transformation projects, and they are applying design thinking, discovery research, and service design, and all those things to the way that they align with stakeholders. But we want to hear from you, and this is in the next Minty slide. We want to hear from you, which of those problems in your current role can you influence the most? Some of you might not be able to do anything about communication or change management. One of you is a CEO. So in terms of consistent leadership, so we'd like you to vote on which can you currently influence the most. And if you are the CEO and can actually help with all of these, which one do you need to do the most right now? August, coming up, 2024. All right. Actually, Josh, I think we maybe, yeah. If you don't have Minty, if you've joined late, you can go to menti.com on your, it's much better on your phone than on a big screen. And you can type in that code at the very top, 1253-5126, and you'll be asked to participate in this poll. Mm-hmm. Okay. Oh, that's great. That's great that we've got people that can do some top-down. Yeah, John, I see that you mentioned that culture is the number one reason that digital transformation initiatives fail. Yes, I think that culture underlines all of these things. And I think that's why the change in communication is so hard. Okay, good. So I'm glad to see that there's a variety of, you guys on this call feel like you can actually get in and change some of these things. Now what we're going to do, let's see how we're doing with time. What we're going to do is talk with Julia Borkenhagen and Peter Orvath. Let me just move to the, who are practitioners. And this is kind of a preview of the upcoming webinar series that we're going to be hosting in the next few months. So what we're going to do is just give you a little bit of discussion about design thinking, discovery research, service design, and stakeholder alignment. Each one of those topics, we're going to spend an entire webinar discussing and showing you tools, showing you deliverables, talking about how to position it, how to sell it. But before we do that, just today, we want to start with a kind of just a lighter kind of introduction by talking to some of the people who will be talking with you later in the series. So first, we'd like to bring on Julia.
Whoops.
Hi, Julia.
Hi.
Hi. Julia is a Chief Experience Officer at Whitespace, and she's been in digital for probably as long as I have. Julia, can you just give us a little bit of your overview of your participation in digital and in technology?
My background, yes. Well, long time ago, right, when the internet started, more or less, or became prominent, I also started, and that was really exciting. At the time, I was in San Francisco working for a digital agency. I got into that actually kind of also a bit like Steve. My original studies were in political science and economics. So I was just really excited, and I've always been very interested in design and have self-taught myself throughout and learned on the pile at the time. It was really exciting. Went to join a startup over there also in Silicon Valley, and then I came back here to Geneva also now quite a few years ago. And yeah, I worked at a digital agency here. I saw the state in Switzerland where we were at compared to the US. Was trying to get a bit more of user experience methodology into the enterprise that I had joined at the time. It was quite a novel thing. In 2005, people were not really familiar with that at all. There was like the maquette, which they say in French, like the just graphical interfaces in Photoshop that would be given to the developers. You know the thing, if you've been around for a long time, that was the deal. So kind of telling them, no, we can do something else. We can actually talk to the users and we can do some rough mock-ups and so on. That was very, very new at the time. And it's still new in certain industries. So I think after all this time, we still feel this resistance in a way of people not really wanting to talk to, being afraid talking to the actual end users and wanting to have finished, polished products before they actually show anything. So I think it's still an ongoing kind of battle, but it's a nice one, and we're getting more and more used to it. It's fun.
All right, Julia, I'm gonna talk with you about this term design thinking, and I know we've got it's a bit like digital transformation. Those of us who have been in the field for a long time have some reservations about the term. But I want to start with a very interesting another study that McKinsey did in the last 2 years, another McKinsey study in which they tried to figure out those 30% of digital transformation projects that are succeeding. They tried to figure out what those companies were doing differently. And they tried to then map out the difference between what they were doing and what the companies that were failing with the digital transformation initiatives, what was the difference? And the two biggest gaps, number one was rapid movement to the cloud. That was number one. Number two was the consistent use of design thinking to enhance user experience. That for me is huge. So if we're looking at the two biggest reasons why McKinsey and all their studies have found companies are succeeding, what's putting you in the 30% winner and achieving your goals, it's the consistent use of design thinking. Julia, first of all, what is design thinking? What does it have to do with human-centered design? Again, you've got a whole webinar coming up in the autumn to discuss this, but just briefly, what is it and how does it help these companies succeed?
Yeah, I think that most people on the call or on this webinar probably know a bit about design thinking. I'm not going to go into any, detail. It's basically, understanding the users, the context, having empathy with them, not going, directly into solutioning, but really taking the time to explore what's out there, what are the different roles, what are their needs, their pain points. And then, going into this ideation mode with a very open mindset after you've defined really clearly what is actually the problem that we need to solve here, because sometimes the initial problem was not the problem that you needed to solve. Once you have defined that, go into big ideation, open up again, and then again, narrow down through prototyping and testing. And the interesting thing about it, also, as most people know, IDEO was the consulting company that really, coined the term, D-School, Stanford as well. It has gotten some flack lately. I think it's still a very valid method. Obviously, it's rooted in human-centered design, which to me is really the gold standard. I think that the ISO standard that we have, 9241, chapter, I think 210, if I'm not misinformed, is absolutely valid. It's the process of how you should go about it. And it just clearly says, you should basically iterate. It's a big iteration process. You have to have a cross-functional team. So it's not just a designer's task, it's really across the different disciplines. And I think that's quintessential to design thinking, is like, we're not alone. We have to take everybody with us to be successful. So in the old days, we did things in our little corner there, and then we said, oh, client, or internally, oh, look here, manager, what I've done, isn't that great? And they would say, yeah, that's okay, but that's not really what I wanted. And they're not invested. So you really have to invest your stakeholders and get them excited about it, even though, in the end, they're not going to be designing the product, but they will be very invested and heavily involved.
Mm-hmm.
I
Julie,
think
this sounds...
could go on forever, but I'm not going to.
Yeah, no, for those of us in the field, and even those of us, when I've explained this to colleagues in totally different fields and people working on the front side of the business, they say this is really obvious. Yeah, you should understand the people that you're building for, and you should open up some ideas before selecting one, and you should test. If it is so obvious, why are so few companies doing this?
Yeah, I think that's a really, really good question. I mean, you've got the very traditional companies that are very IT run, and they're just looking into, acquiring the next software and launching it and doing the minimum change management, hoping, praying that on the other side of the fence, people will pick it up and actually use it. Often they're not. And then they say, about why are you not doing that? And then they might send out a survey about, their employee satisfaction and find out, no, they don't like it, but why are they not like it? So there's those people, I think. I think then there are others, and I've had that actually happen to me personally as well, when I come into a company and it's like, oh, design thinking, yeah, great. We've done that before. We've had some consultants come in there and, they did their spiel, and then we were left with like nothing. We were left with like a big PowerPoint and so what? So I think there's a lot of sort of design thinking theater that's going on. It's very popular, right? It's quite an accessible method that you can imitate. And there's a distinction between doing the real thing and doing the theater thing. And so companies that have been burned by the more like on the theater side, it's not really fundamentally grounded in real user research as well, which we'll talk about, I guess, in the second part. Then they're left with just like little gimmicks and some user journey that's not really meaningful at all. And then I think the last maybe is just time, because it's a time investment. You have to, and we can't say like it doesn't take any time. It does take some time. We can do design sprints, but that's not the same thing either. I'm not going to even go into that whole can of worms.
Yeah.
But it does take a bit of time. And so if they're kind of very, very eager to get things out quickly, it could slow them down initially, but then it will tremendously speed them up later. And that's kind of the thing where you have to try to convince as best as possible that it actually will speed them up. And then also what we always now say is to de-risk your projects. It's de-risking your project. That's my key word that I've been using for the past couple of months. It works really well.
Yeah. Julie, again, you're going to do a whole webinar on design thinking. You mentioned design thinking theater, and I think this is a good transition into something we see more recently in the last 5 years is research theater. People saying, oh, we're going to go do some research. And Giles, you wanted to talk to Julie a little bit about discovery research and the importance of this, and how does this fit into tight budgets and agile processes?
Yeah, well, you said the question. So just to build on that, yeah, like there is a lot of effort that needs to be done for research at times because it can provide so much insights into the problems that are there, but we don't always get the buy-in to do extensive research. And there is that, well, I definitely feel it at times, that stress that you feel where I know I need to learn more, but I'm not being given the time or the resources to do it. And it can be a bit different, that pressure, when you're internal as a researcher versus when you're on an agency side. But that's something also I would like to touch upon there as well. What's your thoughts on this?
Sorry, the question precisely was about the
Yeah,
discovery research. Yeah.
Yeah, there's this discovery research piece that needs to be done, and the fact that we know that research is important, but if you're not doing that discovery research, is going to cause problems. You know, how are you overcoming this at Whitespace? How are we doing it from your perspective?
Like to convince the client that they need to do discovery research, basically, right?
Mm-hmm.
Yeah.
And how to integrate that into 2 to 3 week agile sprints or not.
Right. Yeah, I mean, there's the initial sort of blueprint phase. Let's say a traditional project where you actually develop a product. There on the tech side, they'll have to do some discovery. And on the design side, you have to discovery as well. So I think it's justifiable to say, we spent our blueprint phase on doing some fundamental research to really understand where some of the core issues, what makes people tick, and really get a good picture on that. Then there's another concept of just saying, well, the one-off is nice, but it's also good just if you are working in Agile to just do it continuously. So that's something that, in my experience, can be solved a bit easier because it's really integrated into the process. It can be very light. So we can really say, well, if we talk to 3 users, that's fine. We don't need to do massive amounts of research. But I think, I don't know who said that, Steve Krug or one of the old UXers said, well, you do lots of little user tests along the way. It's a lot better than doing one big one, especially at the end when it's too late, right? So having this continuous involvement and finding a way how to work really closely with development during Agile, whilst still doing research for upcoming sprints, I think that's something that has to be clearly defined, especially when you're in an internal company where you're actually going to defining these processes a bit more thoroughly, right? But it's always a challenge initially doing the research because, especially when you come in from the outside, they don't know you sometimes. They're like, well, who are you? Can I trust you? And so to gain this initial piece of trust, I think that's often a challenge. And if you can have people observe your interviews while being really quiet, but just having a taste of what you're actually doing, they get much more excited about it. So that would be my recommendation, is just to get the stakeholders, again, involved on the journey from the get-go.
Julia, one thing I think we've seen a big difference in some of our clients that are more mature in how they manage the output of research. I mean, we can use the fancy word research ops, but that's exactly what it is. And that you can have different researchers coming in and off different agile projects, and they're not walking in and say, gosh, I think we should go talk to users. What they're doing is they're spending a few days immersed in the research and the personas and the deep ethnographic, deep descriptions that have already happened, and can already start forming hypotheses before they even go back out. And so they're already starting from a place of refinement because that research has been documented in ways that the next group of designers can pick back up and start working on. But that's only the most kind of
that's so rare.
advanced. I was going to say that's only some of our most advanced clients that have been doing this for a lot of time and have felt the inefficiencies of yet going out and talking to users and annoying those same users with a different group of optimistic digital transformers the next time around.
Exactly.
We'd like to move on. So this will be just a reminder for those of you who might have joined late. There will be a webinar series coming up about design thinking. Julie will do one about discovery research. And we're moving on to the next topic, another term that's been rising in prominence in the next few years, service design. So with that, we'd like to invite Peter Orvath, the head of service design at Whitespace, to join us. Hi, Peter.
Hi, Steve. Can you hear me?
Yeah, we can hear you very well. So we saw a lot when at the very beginning, we were asking people to what their role was. So we saw UX, we saw customer experience, CX, UX, and we didn't see many people defining themselves as a service designer. There's a lot of overlap. So what I want you to do, Peter, for us is maybe, even at the risk of exaggeration, highlight the difference, highlight what a service designer is practicing and doing and looking at things in a way that's different than maybe traditionally trained UX designers.
Sure. So first off, I think there's a couple of issues where service design suffers from the same challenges as digital transformation itself. On the one hand, it's a bit loosely defined, and in some cases, and I've heard that from multiple large consultancies, it's being often hailed or sold as like the ultimate solution. Coupling being sold as an ultimate solution and being loosely defined is a dangerous mix already. But similarly to digital transformation, if it is without strategy, without a real goal, and just being hailed as the thing as it is, then it will not deliver, or it will underdeliver. But at least, service design is inherently human-centered. So at least, that's not a barrier that it needs to jump, like what we're hailing here for digital transformation. And to your question on differences in UX and service design, it's a tricky question because, the before mentioned loose definition, but also because there's a big overlap between its tool sets and UX's tool sets. But there are three things that I always say that I'd like to mention here. One being that the subject of service design is not as clearly defined or not defined as it is for UX. So UX, for at least as it's used today and for the past decades, is really an interface related thing. So most probably you will be working on something of an interface, even if indirectly, i.e. for the research. But for service design, it could be anything. So you get a brief, and then the output might be, or the proposal might be, that it should be a training, or it should be a physical facility, a change in the process, or it could be an interface. But there's a lot of opportunities what it could be. And that's, I think, one of the important things. And John Fukuda here in the comments mentioned earlier today that digital transformation might not be a technology-focused thing, really. And that's the same is true for service design. It doesn't need to be related to technology. So this is the first difference. The second difference really is similarly here around the subject of service design, but more specifically, there's this one thing that sets it apart from UX very much, is that it looks at the organization as well as its subject, meaning it doesn't only design the end service, but also the service delivery mechanism, so to say. And Giles mentioned at the beginning that what he does as a clinical UX professional, he focuses on both the doctors and the patients. So there, that example shows as well that the internal users, the employees, the colleagues, are as much users as the end users themselves. And going beyond that, because the employees, colleagues are just players in this system as well. You need to be looking at the system as well, and that's where the third point comes in. That service design is more holistic, meaning that it goes beyond interactions or pointed interactions, both in time, space, and context. Meaning that it looks at drivers and consequences of specific actions. It also looks more at how you got there, so at communications or packaging, as well as what comes after, so customer care, for example. And these links back to the previous post on the where previous mentioned that the subject of service design could be really anything. And
so Peter,
yeah.
So what I'm hearing is that obviously that the second of our big reasons of failures of digital transformation, this mismatch between the service being offered and the context in which people are working. I think I've always just thought, of course, that's what service design does. But what I'm hearing from you is that it also can treat that last one, which is change and change management and communication, specifically that communication bit. What does service design have to do with communication?
Yeah, it's funny. I think one of the first people maybe who I met doing a PhD specifically around the topic of service design, She actually said that she doesn't call herself a service designer. She calls herself a change manager, because on the one hand, that gets her, it gets quicker acceptance from senior management, and it gets her into deeper trenches of the organization. So, what you call it is of secondary importance. Really, it is a lot about the change making and the change management, and this changing of the organization is really an important part in that. But there is a sort of another point to why the change management is really important for service design, and that is because UX has a specific remit that is the primary owner of an interface. But service design often suffers from having really a primary topic that it really owns. And that is because it is so across so many elements of an organization. So really that's a challenge. And because of that, it needs to be, better at managing change, better at talking with people and connecting the different elements of the organization. And I actually argue that that is the only real remit that service design can own fully itself, this connection of the different departments of the organization. Because if you ask, who does, communications, there's a communications department. Who does, sales? Well, there's a sales department. Well, who connects all of these? And you would say, well, the CEO, but that's a really, really high level thing. And at the day-to-day, really service delivery element, I believe it should be service design whose core mission is connecting these elements, filling in the gaps, and orchestrating the movements there. But I would like to point out, the point that UX designers will be familiar with this kind of thing as well. That when they're being downgraded, sort of, or forced into a UI role, that's similar to what service designers might be facing when a department says, well, you know what, that's our thing, so you don't come in here and tell us how to do our job. So there's really a lot of change management and really a lot of communications to be managed there. But at the same time, I would argue that if an effort is only about communications, either externally or internally, I would not call that a service design project. Yep. It happens from time to time that's one of the primary elements, but to me, that's really secondary.
Thanks, Peter. We're running a bit short on time, so we were going to do a whole kind of a teaser about stakeholder alignment. But based on what Peter just said, I'd like to, Peter, just if you could just stay up on the screen for a second. I think that the artifacts, the creations of service designers and UX designers, Dean mentioned, high fidelity prototypes and helping stakeholders imagine how the people involved in a process are going to be impacted. For me, that's one of the best ways to align stakeholders. We've done workshops where we put CEOs, we got them off their feet. They looked through journey maps and thought, we never knew this is what our customers are going through. And we didn't have to do much. We didn't have to say much. We didn't need the big PowerPoint and all the fancy words and the financials. They just felt it. And I think this is a huge thing that those of us who have been working at the higher levels of change now is the ability to create understandable artifacts helps convince and helps people just understand. Wow. And check when things are going to be off. Did you see that in your work, Peter?
I even say that, sometimes your work can be even simpler. There's a story that I like to bring from an old friend of mine who said that all they did in one of their meetings was to force all the heads of departments to listen to a specific interview with a person who they felt really sort of summed up everything well in their research. And all that guy was talking about is how difficult it is when he's being passed on between the different departments of the company. And all of these heads of departments were claiming that, well, we do our job perfectly. But what turned out is that, that connection there is not being delivered. So they do their job perfectly, but they fail to connect the organization into one whole. So, sometimes just the research itself can speak for you.
Yeah. All right. With that, guys, we're wrapping up. We've got 4 more minutes. We need some very critical input. Thank you for the hour that you've spent with us. For some of you in the West Coast in the US, very early in the morning. Those of you here in Europe, we're standing between you and the end of your day. What we'd like is some input from you. So if you could go, Jesse or Giles, if you can put the slide back up for Menti, for anybody who still hasn't scanned that Menti code. we want to ask your input on these 4 topics that we've discussed. We want you to give us an idea of your expertise and your interest, your curiosity and your interest in finding out more in the webinars. So you've got kind of a 2x2. And we'd like to see how you map those things out. This will help us kind of adjust what we're going to be doing in the next few weeks. All right. Good. Design thinking, lots of experience and lots of interest. Good. Service design, high interest. It's good we see the high interest. Yeah. Okay. All right. So this is the average. This is the aggregate of everybody who's responding to the ranking right now. And this is definitely a sweet spot for us to be discussing in the next webinars. If we saw low interest, we'd be a bit concerned. And if we saw a huge gap of expertise, it's hard to run a single webinar with a huge gap of expertise. So you don't necessarily need to split them out. Okay. All right. Thank you very much for that. That helps us a lot on how to present and how to focus our attention and adapt our message to you in the next series of the webinars that we're going to do starting in September. We've got a last question for you, and we're going to leave this up on your Menti to tell us what did you like most about today's webinar, and also then what could we do better at? So we're going to leave that up on the Menti, and Giles, I think if you just put up the date for our next one, the last slide, and we'll say goodbye to you. I think we can join. It's the it has the date of our next webinar. Good, guys. Thanks for these responses. And as soon as we get off the screen, we're gonna move it to. I'll move the Menti to the next slide where you guys can put in your feedback of what we could do better. And Giles, you want to join me back up on the? Anything you'd like to add, Giles, before we?
Yeah, it's been great sharing this stage with you. We had a few technical issues, but it's been great. It's always fun having a live session and the engagement with people. And we're looking forward to having another session with you all. Thanks for listening. The next one is on September 10th. That's what we've got it scheduled for. And we'll be sending out invites very, very soon.
Good. Thank you very much. And guys, I'm going to move the Menti to the final feedback. So if you've got just another minute, give us some ideas about what we can do better next time. Okay. There we go. Thank you.
Bye-bye.